Ruth Dyson.
Mr. Speaker.
Order. I've called the Honourable Ruth Dyson.
Mr. Speaker, my question is to the Minister of Health. Does he stand by his commitment to move health resources to the front line?
What a good idea.
The Honourable Tony Ryall.
Yes, especially so when the outgoing Labor government slashed $150 million out of health just before the election. They left DHBs on a track to financial crisis with around $160 million of deepening deficits. But, Mr. Speaker, the good news is that the new government...
Order. Now, look, the question asked was actually a very simple question, Mr. Ryall, and I think the Minister answered it fairly early on. Anyone got a supplementary question? William Sewer.
Supplementary to the Minister. Does the Minister agree with frontline staff at Counties Manukau who warn that health cuts will reduce participation in health programs by most at-risk groups?
The Honourable Tony Ryall.
Thank you, Mr. Speaker. Look, the Counties Manukau DHB has carried out a major review of all their contracts using a systematic approach which aims to put funds closest to the front line and reduce duplication. I'm advised, for example, in a number of Māori provision policies, programs, their service contracts have increased an overall 42% this year. And one of the reasons they've been able to do this in Counties Manukau is because of a government funding increase of $66 million, or 7%, despite the fact that the previous government cut $113 million out of programs last year.
William Seor.
Supplementary to the Minister. Had the Minister signed his name to slashing $4.8 million for diabetes checks before or after he posed for photographs with frontline diabetes and renal staff at Counties Manukau?
The Honourable Tony Ryall.
Mr. Speaker, that member might not realise this, but his party quietly before the last election cut over $3 million from diabetes programs and $10 million from chronic care. But what I can tell that member is that the saving made that he refers to did not affect any frontline service at all.
Point of order, the Honourable Pete Hodson.
So, the issue is whether or not the question was addressed, and a little reminder that the question was phrased about timing. Did the Minister cut funding before or after a certain event? He has to address that issue of timing, or his alternative is to say that the question is wrong in its construct. He's done neither of those things, and I think he should be invited to.
Order. I think the member will see that in two recent questions I've stopped the Minister because I believed he was going over the top, and I asked another Minister to answer a question. Now, if the Minister believes that part of that question was crucial for the public interest, then forgive me, I must be in the wrong place. As far as I was concerned, the Minister answered the question in a reasonable manner. The Honourable Ruth Dyson.
Does he understand that thousands of undiagnosed diabetics will stay unaware of their condition unless they are checked by frontline health workers, or will he rely on the emergency frontline health workers to treat them when their condition overtakes them?
The Honourable Tony Ryall.
I think that is a very relevant question, and it is a matter that the government is putting resources into. It's a shame that that member didn't ask those questions when the colleague sitting next to her cut $3.3 million from diabetes get checked, cut $17.5 million from PHO performance programs which encourage this diabetes work, and cut $10 million from a funding pool for people with disabling medical conditions. It's all very well to talk about what may or may not happen under National, but they don't want to talk about what they got up to.
The Honourable Ruth Dyson.
The concern of senior doctors that his insistence on moving some hospital services to primary care has serious risks of clinically inappropriate transfers.
The Honourable Tony Ryall.
What this government is seeking to do is to implement the primary healthcare strategy that members opposite think is so fantastic. Fundamental to that strategy is that there should be more hospital-based services in the community. And of course, there are always issues of clinical sustainability, and that's what this government is tackling with. For example, we're tackling the problems we've inherited at Whanganui, where we've got real problems with maintaining our workforce and maintaining services there, but at least this government's prepared to deal with it.
Supplementary, Joe Goodhue.
Thank you, Mr Speaker. My question to the Minister of Health: what significant announcements is he able to make supporting frontline services in public hospitals?
The Honourable Tony Ryall.
Mr Speaker, junior doctors are important members of the team delivering frontline services in our hospital. And this afternoon I'm releasing the Resident Medical Officers Commission, chaired by the former State Services Commissioner Don Hunn, their report. The RMO Commission report paints quite a grim picture of a junior doctor's experience in our public health system and calls for immediate change. Some research, for example, suggests that junior doctors spend 80% of their day doing work for which a medical degree is not necessary. The report calls for urgent improvements to the apprenticeship model and calls for a single national training body to ensure the training and apprenticeship model drives junior doctor experience.
The Honourable Ruth Dyson.
Does he believe that patients in mid-central, Whanganui, Taranaki, South Canterbury, Tairāwhiti, South Auckland, Otago and Southland, as well as those affected by his cuts to mental health services, diabetes and cardiovascular services, are receiving the more convenient health services he promised?
The Honourable Tony Ryall.
Mr Speaker, this government is tackling incredibly big problems inherited from the previous government. And this is a party opposite that cut $150 million out of the health budget very quietly before the last election, cut over $110 million of programs last year, and they don't want New Zealanders to know that we are having to deal with their legacy of mismanagement of the New Zealand Public Health Service.
Joe Goodhue.
Thank you, Mr Speaker. What action is the government taking to respond to concerns about the frontline health services detailed in the RMO Commission report, given that endless reports have called for the rationalisation of funding and planning of health workforce training and for focusing resources on the frontline?
The Honourable Tony Ryall.
It is correct that we have inherited a disjointed and uncoordinated set of resources to deal with the serious and long-standing health workforce crisis. A raft of reports over the years have been critical of this duplication. So the government is responding to these calls by establishing a clinical training agency board to unify workforce planning in New Zealand. The purpose of the CTA board is to work with the government to rationalise the myriad of committees and structures and work groups involved in the funding and planning of health workforce training to improve frontline services, ultimately consolidating it within the Clinical Training Agency. The Medical Training Board has been disestablished.
Question number Joe Goodhue, supplementary.
What reports has he seen about DHBs and their decisions about how they allocate their funds in relation to services?
The Honourable Tony Ryall.
I've seen a range of reports about the need for DHBs to live within their means. Some from Michael Cullen, the former Finance Minister, and some from Annette King, the former Health Minister. But probably the most interesting is the Associate Health Minister in July 2004, who was defending claims of negligence from the Wellington City Mission over funding for aged care. The then Associate Minister said, quote, "How health boards allocate funding was not her responsibility." That Associate Minister, Ruth Dyson, who stands up every day in this House to ask the government to take responsibility when she never would.
Question number